a brief overview on NARCAN, and this is the sort of NARCAN that we give out through the NARCAN Direct program. There are other formulations of NARCAN out there, but this is by far the easiest. The others, we draw up in the syringe at the hospital and things like that. Much more difficult for the public and untrained to use. So this is by far the easiest. So I just wanted to go over with Patrick here. He works with me at the Alliance to Heal. We've been working since you got here, really, a couple years now. Yeah. And so we want to just go over a little bit of signs of an overdose and how to use this, and really promote people having this. I mean, that is one of our goals in the Alliance, is to get more NARCAN distributed, because we are so fortunate that we have an antidote for opiates. There are so many other toxicologic emergencies that you don't have an antidote for. And so the fact that we have this is really phenomenal. So in addition, I always like to emphasize that when someone's unresponsive and not breathing, any rescue breathing you can give is enormously important. One, you may not have NARCAN around on you at the moment. Two, I don't think there's a guarantee in 5 years NARCAN will still be available cheap and free like it is now. That is a grant. The state's been very supportive so far, but we all know things can change. And so that changes. This is all we're going to have left is rescue breathing, which, if done appropriately with a good EMS system like we have, we can get there and save people, but it's got to be initiated right away. So with that, you want to do it? You want me to do it? You can go ahead. So let's first talk a little bit about the signs of an overdose. Sure. So the things you really see when it's time to give NARCAN, and obviously you can't give NARCAN if you're alone. So that's the first thing. So anyone that is using, they really need to have someone with them that is sober enough to give this. And so we're really trying to promote not using alone, because it is impossible when you're overdosed to give yourself NARCAN. It's just the fact. So we really encourage people to have someone, a safety buddy or whatever you want to refer to them as, to be able to administer NARCAN. Otherwise, you cannot administer it. So that's first. So things you see. Respiration. So opiates, what do? They block pain, right? Part of the side effect of that is the fact that the pain receptors also in the brain, some of them, there's an overlap with those that run your respiratory drive. And so the more that these opiates block your pain receptors, the more they block the receptors in the brain, the mu receptors that drive your respiratory rate. And so as those get blocked, respirations come shallower. And that is ultimately what kills people, is the respiratory depression, ultimately respiratory arrest. When you're in the hospital and you go under anesthesia, all of us are at that point. And so a lot of people forget that. We manage that in the hospital because we put you on, a breathing machine. We monitor the breathing, but we give fentanyl all the time in the hospital. Anyone here has had a colonoscopy, anyone that's had any major surgery that you're actually put under, were given opioids to the point where your respiratory drive was diminished. But in the hospital setting, obviously, you're ventilated and you're cared for and monitored. So in this setting, when you're an overdose outside the hospital like this, what you end up having is you get the respiratory rate goes down. So you're going to see patients that they'll start to turn a little blue, especially around the mouth, the lips, they'll start gasping for air. Sometimes you hear choking or gargling sounds, and they become unresponsive. So you can go up, you can shake them, wake up, and nothing, right? And the other thing, you'll start to see pinpoint pupils. That's another common one. The pupils constrict greatly with NARCAN or with opiate overdoses. The fingernails are another one. They turn blue, the skin underneath the fingernails, because you're not getting the oxygenation. So they become blue. And then ultimately, as the respiratory rate goes down, the pulse starts to drop as well. And so they go together. So as your oxygen drops, pulse starts to drop, and ultimately you go into cardiac arrest. The goal is to stop this series well before that, because once you get to that point, then NARCAN doesn't work anymore, because NARCAN's not going to revive the heart. All it does is reverse the respiratory depression. So awesome. Go ahead.
So as Dr. Eberlein mentioned, you're looking for the signs and symptoms that you might see of a suspected overdose. The nice thing about the NARCAN that we're giving out with the NARCAN Direct program is it's intranasal. So basically it's administered up the nose. A lot safer for the people giving the medication and a lot safer for also the person receiving it. Whereas before, oftentimes you'd have a needle. So there's a higher likelihood for a stick or things like that. So super easy route of administration. Comes in 4 milligrams. Basically, you're just going to open the package up, and this is an expired dose. Thank you to Vivin, by the way, for getting us this. There's some instructions that come with it. You can go through too, but we recommend, sort of in these heightened scenes of adrenaline's pumping, that if you are around people who are using, it's good to already know what to do so that when the situation comes, you're not fumbling through the packaging. Alan and I were talking earlier, and it takes about a minute really to get everything unpackaged and ready to go. And in the event of a true overdose, that's quite a bit of time. And then really,
before you,
yeah.
So one thing, and this is a question I get a lot. So after you come upon someone they're unresponsive, if someone's with you, have them go call 911. Don't leave the patient. So, and then initiate either Narcan if you got it or a rescue breath before you go call, because that time frame, if you have to go search for a phone or whatever, they may be at that point where their oxygen has gotten so low that they may be entering cardiac arrest, and that brief intervention may save the patient. And so ideally you have someone with you. And so you would, go get, call 911, because we want to get that emergency medical services activated as soon as possible. But then at that point, you need to start taking care of the patient. So go ahead.
Yeah. So we have the Narcan, taking it out of the package, really just 2 fingers and thumb on the plunger right there. Just going to advance it till your fingers are touching the person's nose, and then just squeeze that whole dose in that one nostril. So that's simple as that. Then you're just going to set that over there. Something to consider is the person might not respond right away, depending on the drug that they took. And then usually after that, it's a good move to put them into the recovery position. So that's where you roll them to the side. That decreases the likelihood if they were to wake up and potentially aspirate or throw up, put them into the recovery position. Continue to assess. If you don't see a change within 30 seconds, a minute or two, and you do have another dose, it would be appropriate then to administer the second dose in the other nostril.
And then in the interim, if you happen to have one of our overdose safety kits, which has Narcan, it has a pocket mask in it, or barrier mask, as well as resources, that would be the time to consider giving some ventilations even before they fully wake up, because you really want to start getting that oxygenation back into the patient's bloodstream.
And this is just a pocket mask here as well.
So it's just a one-way barrier. These are great. We bought these. I think they were like just less than $1 on Amazon. So. That's all right. And then it's got ear loops, so it just goes around the patient's ear. And then you're able to, this thing there.
Yeah.
Then you're able to just seal across. There you go. So it works well. I mean, this does save lives. Fortunately, they have reintroduced rescue breathing and basic life support. That was actually removed a few years ago prior to the opioid epidemic, because they were going to that CPR hands only technique, because at that point the primary was cardiac arrest, and they were worried that people would be less likely to intervene doing this, and so they wanted to increase CPR rates. But now with the opioid epidemic, they've fortunately brought that back. So people are trained in this. It's something that we need to do. Questions on?
Thank you for the demonstration. Where would someone get Narcan? Can you get it at Walgreens?
So it is over the counter at any pharmacy, standing order through the states. That was done a couple years ago. Unfortunately, with that, you have to pay for it. And so the over the counter cost, I believe, is about $80 for 2 doses in a box. The second way is talk to your doctor. If you are at all concerned about yourself or a loved one, you can talk to your doctor, and most physicians that I know of are more than willing to prescribe you Narcan if they think that you or someone in your house is at risk. And then the third way is through the NARCAN Direct program. The county gets it and they distribute it. So there's several agencies. Vivint Health gives it out. Who else is giving it out right now? The county itself. Do you guys actually give it out directly?
We're not able to provide it to individuals, but we provide it to agencies. Like I said, Vivint Health. We also provide it to Coulee Recovery Center and first responders, and even some of the private counselors and others are able to get that. And we do have a supply. I think we have about 8 cases. There's 24 individual doses into each box. So I would say at the end of today's event, we'll be able to, that will be able to be handed out here today.
Excellent. And then, the other thing that we're doing, our first responders, if the, oftentimes the patient that gets a NARCAN wake up, oftentimes they're not ready to come in and get help through the hospital system. And so we are leaving behind NARCAN for those patients with all these resources, with the anticipation and hope that they will reach out to those resources and get the help they need. Hopefully in the future, we can even make that more robust with, maybe a virtual visit on scene. Lots of ideas floating around right now, how best to make that happen. But things we're looking at doing for sure.
As a first responder, is it worthwhile to address that when these individuals do wake up, sometimes they're not all that pleasant?
So that is an argument I've heard a lot about this. This is a large dose in NARCAN, to be honest with you. So this is 4 milligrams. When I started training, I'll age myself a little bit, about 20 years ago, we were given like 0.2 to 0.1 IV dose. And so the thought was, oh, you give too much NARCAN, you immediately put them in withdrawal, they get angry and agitated. The vast majority of patients do not get that aggressive. There is always the outlying one, right? I have found that the majority of the time that the patient wakes up and if they're agitated and combative, there is another substance on board that is driving that, or some other underlying mental health crisis that has to be dealt with. Not a reason to ever lower the dose or to not administer or do, they used to do kind of a titration effect. You can do that in the hospital setting where you've got their vital signs so monitored continuously that I'm able to titrate NARCAN on people in the hospital. But here in this setting, the bigger dose, the better. And in fact, we are seeing now, in the past, when 4 milligrams first came out, this was waking people up, boom. It's not the case anymore. With some of these stronger analogs, fentanyl, the larger dose of fentanyl, we are needing more. It's not uncommon to see 2 or 3, sometimes even 4 doses of NARCAN administered before they could wake up. Yes.
Can you talk some about how giving NARCAN is not dangerous to people? Because I think there's a hesitation, like, well, if I give it to somebody and it's not an opiate, that I'm going to hurt them.
No, the only harm in NARCAN is if it delays other care. And so if that's what you got and you're going to do rescue breathing in addition and do all that stuff, you're not harming the patient by giving NARCAN. NARCAN is basically in there. It's like shooting saline up in your nose if you don't have the opiate receptors. In fact, we had one here that wasn't expired and I'd have you shoot me up and I prove it. It actually has no effect on you. There are some other very, in the literature, there's other things that we sometimes see in EMS, but I'm not going to get into those now. We can handle any of the other consequences of NARCAN, but nothing you have to worry about. Nothing to persuade you to not give it, because the risk of not giving it is so much greater than any problem you can get with it. It's an extremely safe medication.
I think that was important for people to hear.
Yes, thank you.
So many people are hesitant.
Yes, do not be
Things they're
hesitant.
going to hurt.
When in doubt, if you think that's what it is, give it.
The only contraindication to the medication is hypersensitivity to NARCAN, and more than likely it's very rare, and you're not going to know that too.
Yeah, I have yet to see a true NARCAN allergy. In fact, those that have said it's because they felt terrible after they got it, because it put them into some form of withdrawal. No, that's not an allergy. Yes. Other questions? Yes.
I just wondered if you could speak a little bit to the expiration dates on NARCAN and, encourage people that if all you have is an expired NARCAN dose, it's better than nothing. They can remain effective after.
Absolutely. Yes. So Expiration dates are really valuable for hospital and EMS, but if that's what you got on hand, give it. Because even if, let's say it's a little bit less effective, it's the equivalent of 3.5 milligrams instead of 4, right? It's still gonna hopefully reverse that overdose. If that's what you got, give it. An expired dose is not gonna hurt them. It may not be as effective, but it will not hurt them.
Related note, temperature, storage requirements?
So according to the package, it's not supposed to get over, I believe, 120 degrees. You're not supposed to keep it in like a hot car in the summer. It's not supposed to freeze. So we have been, we keep it in temperature controlled units in the ambulances, anywhere in your house would be fine. Automobile storage is a little bit of an issue, like the police. They tend to, I think you guys bring it inside with you, right? Is that how it's going, to keep it on your person? So that's how we got around that, is that has been an issue in other agencies. Last thing you want to do is, here, right, 6 months of the year it could be frozen. And yes, it's not going to work when it's frozen.
If it does freeze though, if you warm it up, it's still effective. It can be used again if it has frozen and thawed.
Other questions? Well, thank you all so much for listening and being involved. I mean, this sort of involvement is how we get to solutions. And it's so important to bring the community together. And just a plug for September 11th, Craig, is our strategic planning. October 11th is our strategic planning meeting coming up. And so we're looking at realigning some goals with the Alliance to Heal. And if anyone is interested in joining our group, we'd love to have you. So the more people, the more energy, it'd be great to have you. So please look into that.